have, because so often in our community, we're told that we don't need certain beauty enhancements, and it's so taboo sometimes that people don't even know what questions to ask, and we get into the things like what's going on now with veneers by Vanessa and all the people who are unlicensed who are doing Botox and fillers, which further creates an issue in our community. So I wasn't even going to get to this now, but let me ask you, what are the things that if someone is not able to travel to go to you in Houston, what are the things that are most important that someone should be asking of the person who's going to be injecting them to make sure that it's safe?
I think that the most important question they should ask is, how are you trained to do this? And, where did you go? Are you licensed? Number one, what are the risks? And make sure your injector knows what the risks are. Because that's the most important thing. Sometimes you might sit in someone's chair and products are from Amazon.
China.
Right.
I've heard that the girls are getting things from Alibaba. So that's true.
That's true.
That's true. Yeah, for unlicensed.
And
okay.
No shade, but safety is first. Yeah. That's what matters. Safety.
So aesthetics is one of those really hot industries that I feel like all the girls want to get into, and the new grads. Let's talk about, number one, if aesthetics is an appropriate industry for new grads, and then let's talk about how you even know if aesthetics is for you, because we don't do that in nursing school. Like, we don't do injectables, Botox, fillers in nursing school. So,
I think that, okay, I guess the question I'll start with, is it for you? I think that has to be something that really comes from within. I think that whatever you do, no matter if it's psych nursing or it's OB or whatever it is, I think that you have to really have that level of passion and love for what you do, because you're still dealing with humans and still dealing with risks that are, that come with it. So I think that you really have to feel like, is that for me? And then also having an artistic eye. Like, yes, it's still medicine, but there still has to be some sort of artistry still wrapped into it in a sense, so that you can make it look like you want to look. Yes, fix those things, but make it look good.
So, do you feel that it would be appropriate for a new grad? And if so, what things could a new grad do, or someone while they're still in nursing school, to make themselves a great candidate for aesthetics?
I feel like maybe get experience first as a new grad. And then also you can do internships. Like with someone like us, you can come and get hours in and kind of see and shadow and, get a gist of how things are before just going straight into it. Because like you said, you don't want to just go straight into injecting someone and you really don't know the risk, you don't know the anatomy, because it's different from what we learn in nursing school. So I think, get some hours in first. Kind of shadow first, and then see if it's really what you want to do. Because it has to be in your heart. You can't just walk in and say, okay, I'm going to inject someone's lips, and you really don't know how to go about it. So
that's bad. And I think a lot of people try to do it on their own because they glorify entrepreneurship, but realistically speaking, like you said, you still need that opportunity to be able to.
You need
learn.
someone. You need that community.
Yeah.
Instead, even we need a community.
No fact. And we've had built that community just within our peers around us, within each other, but then also the medical directors and our nurse practitioners and just the different things that just the conferences and all that stuff matters. It matters.
Yeah. So let me ask you this. So you talked about the conferences. So when you're first seeking out aesthetics, so obviously, technically you could graduate and start injecting people, depending on what state you're in. Depending on what state you're in, you can. But I think so much of the artistry truly comes from taking these courses and classes. So are there any courses or classes or conferences that you feel like if you are in the industry, you should absolutely attend?
No.
What? Okay.
I mean, maybe unpopular opinion, but I don't think that there's a specific reigning champ of conferences and things right now, because I do think that a lot of these conferences sell this false narrative. They sell that you can come and take this 8-hour course and you're going to learn Botox, you're going to learn fillers, and then you're going to go out and you're going to find your MD and do X, Y, and Z, and you can start your own practice. And I don't think that that's the simplicity of the business itself. I think that you're going to continue the same way we still do our CEUs, and we still take classes, and we still do all of that stuff just to stay up on our nursing license. I think there's so many things that you have to do to really ensure that you're competent before you take that. So I feel like you need a combination of different programs and courses and classes, especially depending on the specialty that you plan on offering within your practice. I think that you need a combination of a lot of them versus just one.
You're always learning something new.
Always.
Yeah.
This is that one like end all be all. I don't think that there's one out there, and I think that a lot of these places are selling also actually saying that.
I think that so many people sell people on you can be your own boss.
Yes.
And honestly, let's talk about it, because in nursing school, we never had to sell anything. I never had to say, come buy this.
Right.
You need to take this medicine. I never had to sell to someone to take their medicine to be well. I mean, it's psych sometimes, but let's talk about that. So I think that there's a lot of different pillars to aesthetics. It's marketing,
yes,
but it's also skill. So where do you learn the marketing piece?
I feel like with marketing, I feel like authenticity is where it begins, because, for instance, our marketing is us. You know, like, we're different when we come into this. Like, it's not what you see on a general sense of, okay, this is a Medspa and this is their Instagram. Like, ours looks so different, but it's so us. Like, I feel like marketing is just, it's how you are.
Yeah.
Because our marketing is a little different. So when it comes to marketing, I feel like marketing team is top tier. You have to have a marketing team. You can't do it alone, because you are getting so wrapped up in clients that you may forget, oh, I forgot to post today. So I feel like having a team is number one. That's what you need.
Yeah.
Shout out to our team.
Yeah.
Right?
Okay, so the difficult question: hiring and firing staff. Okay. So when it comes, so let's talk about hiring first. Okay, let's make it easy. So when it comes to hiring, because when you are in aesthetics, you have to hire a medical director, like depending on what your discipline is. You have to possibly hire like other injectors. What are the things that you feel like you look for in the qualities of both of those people?
I think they have to they need to understand our vision. Because at the end of the day, we're hiring staff to come in and help us and support our vision. So they really have to understand like what is it we're going for, what we really want to put out into the world from just the health world itself. And I think that they don't understand that. They can't really, how can you support us in that way? How can you support the new techniques or the new trainings or new services we want to offer if you don't really support where we're going with this? So they have to, that's one thing they really have to, and they have to be competent.
Yeah.
That's what number one, I'm sure. But
yes.
They need to be competent, but then also like support our vision and support our dreams and the reason why we started, and really and care. You know, care about it.
I think that's big, talking about having the same vision, because even for me as a psych NP, when I interview providers, because not every state is a full practice authority state. So in some states, I do have to collaborate with a physician. And that's one thing that I feel like I'm always asking when I'm interviewing people. What is your philosophies on treating this? It's rare that I even need to call a collaborating physician, but what is your availability like?
Right.
What are the things that you would want me to call you with? Because I'm not calling you after every patient.
Right.
Like, that's what we're not about to do.
Right.
So
I need some standard order.
Right. So we need to understand like what the confidence level is that I have and I'm coming in with. What's the level of competence and education that you have, and making sure that we're kind of on the same page with how we treat patients.
It has to align.
Yes.
Everything has to align.
Yes, that's a fact. So for people who are maybe interested in getting Botox or fillers, what would you say? So first, let's just go back to the basics. What is Botox? What are fillers? Because I know that's what people are probably wondering, like, watching this. And if you don't know, baby, I got that good Botox. It has kept me gainfully employed, okay? Because after we had to take the mask off, sometimes my facial expressions can get me fired. So
Yeah, Yes. So, I guess I'll start with Botox. So, Botox is, I kind of like explaining to my clients, like, especially the first timers, like, it's like Kleenex, right? So, Kleenex is that brand name, but Botox is just one of there's 4 brands right now, 4 or 5 brands right now on the market. So, Botox is one of them, but they're neurotoxins, and neuromodulators. So, what they do is they relax the muscles to change the way your actual muscles sit, like the expression that your muscles get. That's how the frowns here kind of stop that. You can kind of do the lip flips and different things like that. So, but they're all neuromodulators. And then fillers are typically, the most common ones typically are made of hyaluronic acids, which they come in different substance forms so that you can put them in different areas to imitate different things. So what you put in the lip is going to be different from what you're going to put in the jawline, which is different from what you're going to put on the cheek. But those are kind of the bread and butter of what they both are.
And you know what? So obviously it's not you ladies, but allegedly there is a person in Houston who has been injecting some people, and they are not improperly, and this person is not a nurse. Okay. This person is allegedly a lash tech. So we got into the questions earlier about what someone should ask beforehand. What are the major things that someone should immediately go to the ER if they experience?
I feel like when it comes to filler, the main thing that we, like to watch out for is vascular occlusion, which can be when we block off the blood supply. So if that happens, you need to immediately go to the emergency room. And that's why when we see so many, aesthetic businesses popping up, and they're using these hyaluronic pens, it's kind of like you can't really gauge where you're going with someone when you're doing filler somewhere. And like I said, no shade, but that's a risk that you're taking when you sit in someone's chair and you don't really know whether they're certified or not to do this.
Right.
So it's like if that happens, like that's a huge risk. That's a huge risk cutting off someone's blood supply. So immediately go to the emergency room.
Please.
Yeah, because that's dust to the tissue.
Yes.
So I think the other thing that is concerning for me is that when we have these people who are unlicensed or who don't have that much experience in troubleshooting, they don't know at what point to get a provider involved or to tell the person to go to the ER. So I think that's the biggest concern. And I know for some people like that sometimes going to a person that is unlicensed is a cost saver. But I really need women to know that you're really not saving money in the long end. Because you might not have a reaction now, or you might not, you might not have to go to the hyperbaric chamber for your lips now, but it can definitely happen down the line. And, I know y'all offer like payment options. There's a lot of different options, so you don't have to necessarily come out of pocket thousands your first time. But my concern is just being able to do it safely and not taking the cheap route because it can really, really hurt you.
Yes.
And like fun fact, to be honest, in certain states, I know Texas is actually one of them, you do not have to be a registered nurse or a licensed provider to actually provide Botox and fillers.
You could do anything over again, like restarting your launch. What if anything would you do differently?
We would have went in head on.
Head first.
Head on, I'm telling you.
So how did you start and how would you change it?
Well, we started small.
Okay.
We started small first. So we started as concierge, and then we went into getting our suites. And we constantly question ourselves, like, are we ready for this? Are we ready to go full throttle?
Right.
I mean, I feel like we should have just did it. We really should have just did it.
I think, like, because everything that we've put in so far is come back tenfold. So it's one of those things where it's like, why not just put your all into, what it is that you want to do versus actually, I'm not going to say in no shade because our jobs, I feel like at that time were able to really help fund what we were doing.
Right.
But the hours and the time that you spend working for someone else, come on now, talk about a word.
And it's scary.
It's scary.
It's very scary. Like, we're not saying it's easy because it's not easy.
Yeah.
It's very scary.
But you put so much time into working for someone else and building someone else's dream that they started with the vision, and you don't know that you kind of you leave so much of yourself out of it, But I think that when you really have something that you thought about and you put your heart into and you spend the time to really do the work. It's just like you kind of got it comes to the point where you have to bet on yourself, and you can. This is not one of those like industries where you can kind of be like one toe in,
Right?
Because things are changing every day. So it's like you really want to be full in. So I think that if we would, I mean, I'm grateful for how we did it and thank God for it. But I think that we would have really just like balls to the wall, like
we're always learning.
We're always learning. Of course, everything's clear in hindsight. But it's a beautiful process, and you learn a lot along the way. And I think really trusting yourself is a big thing in it.
Yeah, I think the economy now, everyone is just a lot more conservative than they were a few years ago with, quit your job. And I think it's a really important part of an entrepreneurial journey to know at what point can you realistically leave your 9 to 5.
Yes.
Because I know on my side, I did not leave until I had 8 months. I waited the additional 2, because everyone's saying 6 months. I said, I'm gonna wait 8 until I had replicated what I was making in my own business before I stepped out. And even so, I still kept my toe in and still, still kept contracts. I still work. I'll never stop being a psych NP, even if I work 1 hour a week. But I think it's a really important part of knowing when is the time to leave.
And I also say, don't compare your journey to someone else's, because what may work for you may not work for someone else. Because like you said with the working thing, someone may can still work and still have their business a successful business, and then someone jumping out and just going full throttle may not be for you. So do not compare your journey to anyone else's.
Because even today,
you have your own journey,
and we're partners, and our journey is different. Like just even our process and like how we do it and how we operate. Because one, we operate 2 different states, so the states require they're different people. It would require a different process and a different way you go about things. And I think that, and then also you think about it, like, you have families and you have so many other external factors that really play a part inside of your business. So I think that, like I said, 2 people, different journeys, you could be on the same thing, but when like, it's time within your journey, I feel like, even for me, I feel like it was one of those things where I just 100%, I could not give, if I'm going to a job, I was a director of nursing, going to a job and I'm giving the job 100%. And then I go home and I got to give my husband and my son another 100%. What the hell I have for the business?
And for you.
And for me.
Okay, so for the girls that are convinced to start aesthetics straight out of nursing school, because it's always 1 or sometimes 2. So I'm going to give my own advice, because I started in the ER. So I feel like if they were going to start aesthetics and they could not wait, what's one piece of advice that you would give them? I must just say, first, please go and work in the ER. Because the ER is going to give you especially if you can get into a level 1 ER. Like if you're out in Atlanta, go to a Grady. I would even do it in a Grady, where you're going to see everything. I mean, a level 1 hospital in the trenches, like a Johns Hopkins, the University of Maryland, if you're in Baltimore. Because that's the places you're going to see those messed up fillers.
Oh, yeah.
That's the places that you're going to see the complications, but also I have a couple of friends that are ER nurses. One of them from Baltimore could literally get a vein in a junkie, a dead junkie at that. Right.
That is this girl here.
I'm gonna get your vein.
Listen,
I'm gonna find it.
When you work in the hood, they are the best at IV hydration. And I think that one thing that you should be focused on if your true passion is aesthetics is being the best.
Absolutely.
Right.
And learning from the best. And you're going to find them in those inner city level 1 hospitals.
Yes.
I agree.
So what's your advice? What you think?
I would say, honestly, go work at a Medspa. Try to get into a Medspa. Don't try to start it on your own. I mean, hey, I guess we're not people to tell you that. In the same token, I think that's something that we've learned from that. Like, you go inside of a Medspa, it's set up for you to where you're not worried about the business and everything else. You're just learning how to perfect what you're doing.
And getting experience.
That
You're
experience.
getting experience.
That's not one piece of advice.
Yeah.
Yep. Same. Go get hours. Go work under someone. Get an internship and get experience first. I would say. I mean, hey, by all means, do what you like, but I feel like that's the main thing you should do. Get experience.
For the girls who are interested in Botox and filler, like if you don't even know where to start, like what should they do? If they just wake up and be like, you know what, I think I want Botox, I think I want fillers, like, what's the next step?
I say reach out and do a consultation and ask all the questions you have. And even once the consultation is completed, if you have more, reach out again. We're your injectors. You know, we're here for you. That's what we're here for.
Yeah.
So reach out, ask questions, do the consultation. We'll give our recommendations. You know, and if you're not ready for it, we're always there. We're always there. You can always come back to us.
Yeah. So the girls have seen my before and after. So how can they connect with you? Like if they want to book and do Botox fillers, or just tell them what services that you're able to offer. You know, who you serve and where you are.
Yeah. I'll let you go.
No, go ahead. Yeah.
So we are located in both Houston, Texas, and North Carolina, and you can follow us at the Health Lounge, and that is at TheAlthLoung.
And also, I think this maybe is a good opportunity to, we are soon launching the Learners Lounge, which, yes.
Ooh, okay, what's the Learners Lounge? Tell us. Period. Yes.
So the Learners Lounge is going to be an opportunity for nurses, MDs, and NPs to be able to train with us to have an introduction. Emphasis on introduction into the world of aesthetic medicine. We'll go over Botox, fillers, IV hydration, with some branding tips and some marketing tips, and just how to get started as a basis of wanting to get into the industry.
I love it, ladies. Well, thank you so much for coming. It was a pleasure to have you and to talk about aesthetics from both sides. I think this is going to be really valuable for both people who are patients, potential patients, or nurses or providers who possibly want to get to aesthetics, because the queen is definitely there. So,
hello.
yes. Okay.
Thank you for having us.
Thank you for coming.
Thank you so much.